If you're over 60 and you've noticed your teeth starting to crack or your gums pulling away from your teeth, what I'm about to tell you might shock you. 3 out of 4 adults your age are dealing with serious gum disease right now, and most have no idea how dangerous this really is. Your mouth isn't just aging randomly. There's a hidden process happening that starts accelerating after 60, and it's connected to your heart health, your brain function, and even your risk of diabetes. The most important tip I'll share is at the end of this video, and it could literally save your life, so please don't click away. Here's what most people never realize about what happens to your mouth after 60. This isn't just about vanity or having a nice smile. The bacteria that cause gum disease release toxins directly into your bloodstream every single day. These toxins travel to your heart, your brain, and every major organ in your body. Research from Harvard Medical School shows that severe gum disease increases your risk of heart attack by 40% and stroke by 70%. But here's the hopeful truth. This process isn't inevitable, and you can stop it even if it's already started. How old are you right now? Write your age in the comments below because I personally reply to everyone, and I want to give you specific advice based on your age. The strategies I'm sharing work differently depending on whether you're in your early 60s or your 80s, so let me know where you are in life. Let me start with something that might surprise you. The real reason your gums start shrinking after 60 isn't what you think. Most people blame it on brushing too hard or just getting older, but the truth is much more complex. After menopause, women lose up to 30% of their estrogen, and this hormone directly affects the health of your gum tissue. Men experience something similar with declining testosterone. These hormonal changes make your gums thinner, more sensitive, and less able to fight off bacteria. When your gums can't defend themselves properly, they start pulling away from your teeth to escape the constant irritation. This creates pockets where more bacteria can hide, making the problem worse and worse. The solution isn't just better brushing. You need to support your gums from the inside out. Start massaging your gums gently with your clean finger for 2 minutes every morning. This increases blood flow and helps deliver nutrients to the tissue. Then, rinse with warm salt water. 1 teaspoon of sea salt in 8 ounces of warm water. The salt reduces inflammation and creates an environment where harmful bacteria can't survive. Do this every single day, and you'll start seeing improvement in just 2 weeks. Your teeth are cracking more after 60 because they're literally drying out from the inside. Most people don't know that your teeth have tiny tubes called dentinal tubules that carry moisture and nutrients from the inside of the tooth to the outer enamel. As you age, these tubes start to close up, making your teeth more brittle and prone to cracking. But there's another factor that makes this much worse: medications. If you're taking blood pressure medications, antidepressants, antihistamines, or pain medications, you're probably dealing with dry mouth as a side effect. Without enough saliva, your teeth don't get the minerals they need to stay strong, and they become like dried-out wood that splits easily. The scary part is that once a tooth cracks deeply enough, bacteria can get inside and cause an infection that can spread to your jawbone or even your bloodstream. To protect your teeth, you need to keep them hydrated and mineralized. Sip water throughout the day, but not just any water. Add a pinch of sea salt and a squeeze of lemon to help your body actually absorb the water. Chew sugar-free gum with xylitol after meals to stimulate saliva production. And here's something most people never think of. Sleep with a humidifier in your bedroom. Dry air makes dry mouth worse, especially if you breathe through your mouth at night. The bacteria in your mouth after 60 aren't the same bacteria you had when you were younger. As your immune system changes with age, more aggressive, dangerous bacteria start taking over. These bacteria produce acids that are much stronger than what your teeth dealt with in your younger years. They also create biofilms. Think of them like a protective shield that makes them almost impossible to remove with regular brushing and flossing. The most dangerous of these bacteria is called Porphyromonas gingivalis, and research shows it can actually travel from your mouth to your brain, where it may contribute to Alzheimer's disease. This isn't just about your teeth anymore, it's about protecting your mind. You need to disrupt these biofilms regularly, and regular toothpaste isn't strong enough to do it. Mix 1 teaspoon of baking soda with your regular toothpaste twice a week. The baking soda is alkaline, which neutralizes the acids and helps break down the biofilms. Also, oil pulling with coconut oil for 10 minutes 3 times a week can pull bacteria out of those hard-to-reach places. Swish 1 tablespoon of coconut oil in your mouth, then spit it out. Never swallow it, because it's full of the bacteria you're trying to remove. Your bone density loss after 60 isn't just affecting your hips and spine. It's also affecting your jawbone, and this is causing your teeth to become loose and your gums to recede. When the bone that holds your teeth starts to weaken, your teeth lose their foundation. This is why some people notice their teeth feeling different when they bite down, or why gaps start appearing between teeth that used to fit tightly together. Osteoporosis medications can actually make this worse by affecting how your jawbone heals and regenerates. The condition is called osteonecrosis of the jaw, and while it's rare, it's something you need to be aware of if you're taking bisphosphonates. To support your jawbone health, you need to give it the right nutrients and the right kind of stimulation. Vitamin K2 is crucial because it directs calcium to your bones instead of letting it build up in your arteries. You can get K2 from fermented foods like sauerkraut, kimchi, and aged cheeses. Magnesium is just as important as calcium for bone health, but most people are deficient. Take magnesium glycinate before bed. It helps with bone health and also improves your sleep quality. For stimulation, chew raw vegetables like carrots and celery every day. The mechanical action of chewing signals your jawbone to stay strong and maintain its density. The inflammation in your mouth after 60 is connected to inflammation throughout your entire body, and this creates a vicious cycle that accelerates aging in ways most people never realize. When your gums are inflamed and bleeding, your body is in a constant state of emergency, producing inflammatory chemicals called cytokines. These cytokines don't just stay in your mouth, they circulate through your bloodstream and cause inflammation in your joints, your blood vessels, and your brain. This is why people with gum disease often have more arthritis pain, higher blood pressure, and more memory problems. The inflammation also breaks down collagen throughout your body, which is why your skin might be aging faster if you have gum problems. You can break this cycle by reducing inflammation, both locally in your mouth and systemically throughout your body. Turmeric is one of the most powerful natural anti-inflammatories available. Make a paste with turmeric powder and coconut oil, and gently massage it into your gums twice a week. Leave it on for 5 minutes, then rinse thoroughly. For systemic inflammation, add omega-3 fatty acids to your daily routine. The best sources are wild-caught fatty fish like salmon, sardines, and mackerel. If you don't eat fish, take a high-quality fish oil supplement with at least 1,000 milligrams of combined EPA and DHA. Green tea is also incredibly powerful for reducing inflammation. Drink 2 cups of organic green tea daily, but drink it between meals, not with food, because the tannins can interfere with iron absorption. Your saliva production decreases by up to 60% after age 60, and this is one of the most underestimated threats to your oral health. Saliva isn't just water, it's packed with antibodies, enzymes, and minerals that protect your teeth and gums 24 hours a day. When you don't have enough saliva, harmful bacteria multiply rapidly, acids stay in contact with your teeth longer, and your mouth can't heal itself properly. This is why many people notice they wake up with a terrible taste in their mouth, or why their breath has gotten worse as they've gotten older. Dry mouth also makes it much harder to taste food properly, which can lead to adding more salt and sugar to meals, creating other health problems. The solution requires a multi-pronged approach that addresses both the symptoms and the underlying causes. First, identify if medications are contributing to the problem and talk to your doctor about alternatives if possible. Stay hydrated, but sip water throughout the day instead of drinking large amounts at once. Your body can only absorb so much water at a time, and the rest just passes through without helping. Stimulate natural saliva production by sucking on sugar-free lozenges with xylitol, especially before bed. Avoid mouthwashes with alcohol, which actually make dry mouth worse by killing both good and bad bacteria. Instead, use an alcohol-free mouthwash or make your own with water, sea salt, and a drop of tea tree oil. The connection between your oral health and your blood sugar becomes much more critical after 60, especially if you're pre-diabetic or diabetic. High blood sugar feeds the harmful bacteria in your mouth, making gum disease much more severe. At the same time, the inflammation from gum disease makes it harder for your body to control blood sugar, creating a dangerous cycle. People with severe gum disease have blood sugar levels that are on average 20% higher than people with healthy gums. This means that taking care of your mouth isn't just about your teeth. It's a crucial part of managing your diabetes and preventing complications like neuropathy, kidney disease, and vision problems. If you're dealing with both gum disease and blood sugar issues, you need to address them together. Cinnamon is particularly helpful because it has both antibacterial properties for your mouth and blood sugar lowering effects for your metabolism. Add half a teaspoon of Ceylon cinnamon to your morning routine. You can mix it into yogurt, oatmeal, or even just stir it into water. Monitor your gums closely if you're diabetic, because they'll often show signs of blood sugar problems before you notice symptoms anywhere else. If your gums start bleeding more, swelling, or changing color, check your blood sugar more frequently and talk to both your dentist and your doctor. Your teeth grinding and clenching, called bruxism, often gets worse after 60 due to stress, medication side effects, and changes in your sleep patterns. Many people don't even realize they're doing it because it happens while they're sleeping. But the damage from grinding can crack your teeth, wear down your enamel, cause your gums to recede, and even change the shape of your face over time. The constant pressure can also cause headaches, jaw pain, and neck tension that many people assume is just part of getting older. Certain medications commonly prescribed to people over 60, including antidepressants and Parkinson's medications, can make bruxism much worse. If you wake up with jaw pain, headaches, or if your partner tells you they hear grinding sounds at night, you need to address this immediately. A custom night guard from your dentist is the gold standard, but there are things you can do while you're waiting for that appointment. Practice progressive muscle relaxation before bed, starting with your jaw muscles. Clench your jaw tightly for 5 seconds, then release and let it hang loose for 10 seconds. Repeat this 5 times. Apply warm compresses to your jaw muscles before bed to help them relax. Avoid chewing gum, hard candies, or tough foods if you're dealing with jaw pain. And here's something most people don't know. Magnesium deficiency can make muscle tension and grinding much worse. Take magnesium glycinate about an hour before bed to help your muscles relax naturally. The final factor that's destroying your oral health after 60 is something most people never consider: the toxic load in your mouth from old dental work. If you have amalgam fillings, crowns, or bridges that are more than 10 to 15 years old, they may be slowly releasing metals and other substances into your mouth. Mercury from amalgam fillings becomes more volatile as you age and your mouth chemistry changes. Old crowns and bridges can harbor bacteria in microscopic gaps that no amount of brushing can reach. These bacteria produce toxins that are constantly irritating your gums and being swallowed into your digestive system. The constant low-level inflammation from old dental work can suppress your immune system and make it much harder for your mouth to heal from other problems. If you have old dental work and you're dealing with chronic gum problems that don't respond to treatment, it's worth having a biological dentist evaluate whether your dental work could be contributing to the problem. In the meantime, support your body's natural detoxification processes. Cilantro is a natural heavy metal chelator. Add fresh cilantro to your meals several times a week. Chlorella supplements can also help bind and remove toxins from your system. Drink plenty of clean, filtered water to help flush toxins out through your kidneys. Let me remind you of the most important thing we've covered today. The changes happening in your mouth after 60 aren't just cosmetic problems or inevitable parts of aging. They're warning signs that your body needs more support, and they're directly connected to your risk of heart disease, stroke, diabetes, and even dementia. But here's the encouraging truth. Your body has an amazing ability to heal and regenerate, even in your 60s, 70s, and beyond. Every positive change you make, no matter how small, starts working immediately. Your gums can become healthier, your teeth can become stronger, and the inflammation that's aging your entire body can be reduced dramatically. You're not powerless against aging. You just need the right information and the commitment to take action. Even if you can only implement one or two of these strategies right now, start there. Consistency matters more than perfection, and small changes compound over time into dramatic improvements. If this information has been helpful to you, please hit the like button and subscribe to stay updated with more health content specifically designed for people in their 60s and beyond. Ring the notification bell so you never miss a video that could improve your health and quality of life. And please share this with friends or family members who might be dealing with similar issues. They'll thank you for thinking of them. Which tip surprised you the most? What other health topics would you like us to cover? Write your thoughts in the comments below, and remember to include your age so I can give you personalized advice. Your health journey doesn't have to be a lonely one, and it's never too late to start taking better care of yourself.